Good morning, everyone. Good morning. This is the Forum, and I have a guest on the phone. Cindy, can you hear me?
I can.
There you are. Yes. Cindy, I've got some exciting stuff to cover. I know that you're on a short leash for time, so we're going to do kind of a two-pronged thing here. I listened very diligently to Governor DeSantis's presentation yesterday, and I've got information on the whole thing of phase one, everything he talked about, and I'm going to cover that after we're done with our part of the program. How's that?
Sounds good.
First thing, let me mention now while you're on the phone, um, he talked about long-term care facilities, of which you are one, and mentioned that the uh, visitation is still suspended. By the way, these regulations are going into effect Monday, which is May the 4th, I believe. These are the new regulations, plus all the phase one. Um, mandated strict staff screening, directing all staff that interact with residents to wear masks in long-term care and residential facilities. I'm not sure the public out there know that what you are going through. That's one of the things we talked about getting you on the air to cover how you are coping with the restrictions and what you're doing in your community. Go ahead.
Well, I can answer that. Yep. We started in March, at the very first hint of this in our area. Obviously, we follow all the CDC guidelines as well as state and local guidelines. We are, very well in tune with everyone, but we test all of our employees upon arrival at work every morning. We test and screen residents twice a day as well. They get their temperature taken every day, a couple times a day. We all wear masks, gloves, and have a very involved and intense sanitation program throughout the day because we are an assisted living community. We do practice that daily anyway, but we have stepped it up quite a few notches based on the CDC guidelines.
Right. And by the way, I'm sorry, I get excited. I jump right into it. We're talking to Cindy Allen, who is, what is your title again?
I'm the Senior Community Relations Director here at Addington Place, in Stewart.
Yep. Which is located on the corner of Indian Street and Astor Lane, right.
Yeah.
Been around for how long now? How long has that building been in existence?
We'll be 10 years old. Yeah. I've been here 9 years. So yeah, we'll be 10 years old here coming up pretty soon. So we are formerly Allegro Senior Living.
Yes.
We've been under the Addington umbrella since October of last year.
Are we planning on a nice cocktail party to celebrate the 10th anniversary?
Oh my gosh, yes, sir. Absolutely. We'll do it up as only we can, right?
And I will be there again. I mean, I'm there for all these momentous occasions, opening, anniversaries, and all that stuff, as long as I can make it. Okay. Did you get a rapid emergency response team in from the state?
Did we what? I'm sorry, I didn't hear that.
Did you get a rapid emergency response team from the state?
I don't know what that means, Pat.
Well, I think that was probably in nursing homes for training staff on infection control and all that stuff.
We have training here. We've had it ongoing through Addington, and our Cedarhurst is our management company that oversees our community, and we follow AHCA, American Healthcare Association, as well as the CDC guidelines. So we've overdo it, I think, a little bit. We, our meals, we continue to have fresh, healthy, delicious meals. We've changed the dining practices to align with CDC guidelines regarding social distancing. So residents are getting a little spoiled. We're delivering their meals, and we've also adjusted our activities as well to practice social distancing while the residents are still getting out and getting exercise. We have our own Empower Me Wellness therapy programs here. We continue with those. Adjustments are designed, to protect the residents. We do in-room therapy and social distancing, of course, to help maintain their strength and well-being and make them happy.
Well, it looks like we have in the state of Florida 697 nursing homes and 3,098 assisted living communities.
Mm-hmm.
That's a lot.
That is a lot.
That's a lot.
Yeah.
Now, here's something. All right, go ahead.
Well, we're a large community, as you know. You've been here. We have independent living, assisted living, and memory care. So, our community, albeit, yes, it's assisted living, we have a very large community where spacing is pretty easy to do. We have a lot of outdoor walking areas, and truly a lot of our residents are doing a lot more walking than they did before to get out and get some fresh air. They all wear masks, all the residents, and some of them are in some pretty nice looking masks. We had a family member of one of our residents that made the masks for our residents. We all wear the surgical masks here as far as employees are concerned, but the residents are wearing some pretty interesting, colorful masks, and they're very excited about having those on because a family member made them. So it's pretty cool.
Well, I read somewhere that someone was chided for having a mask with the what do you call it? The Southern flag on the mask.
Oh.
And it caused a bit of a stir.
Yeah.
Anyway, by the way, here's another fact. I love facts. Facts take the argument out of an argument.
Mm-hmm.
And this is unbelievable. And again, people need to know this. The Division of Emergency Management has delivered nearly 7 million masks, nearly 1 million gloves, and more than 500,000 face shields and 160,000 gowns to Florida.
Wow.
That's a lot.
Yeah, and we are real fortunate, here, proactively, Addington Place, the Cedarhurst family made sure that we had all of that in place. And, we have our own, just as we do a hurricane closet, we have, a closet for these things as well. And so we were pretty well ready to go from day one, obviously with gloves and having the masks here, and anything that we need, they've provided. And really, we have on-site testing kits in our communities to stay ahead of the spread. We have the on-site testing in addition to symptom screening.
Right.
So we can administer testing to residents and employees if anyone shows any symptoms. Right now, we are free of any. We don't have any cases, and which we are very, very proud about.
Right.
But we closely monitor everything. Our community director, executive director is Anna Sorrentino, and she has been, incredibly vigilant in making sure that, this community is monitored around the clock. And the residents, I think, in as much as sometimes you feel like you need to get out. Well, as I said, this community, albeit it is sort of like a cruise ship that doesn't go anywhere.
Yep.
It is a large enough community where folks can, social distance and get plenty of exercise and keep moving. I know that they wish that we could open our beauty salon. A lot of the ladies would love that.
Right.
But we are we're providing services to get that done as well, in our own way, and making sure that it's done safely. So with that being said, Pat, I've got to jump off. I have a meeting to go to myself, but I really appreciate all you do, and I will be listening here in a little bit to all the new updates from the governor, and I did watch some of it yesterday. But thanks so much for giving us a minute to spend with you, and you be well to you and yours.
Yes, remember that this show will be on my website, and all this information will be on there for you to go to later.
Absolutely great. Again, thanks again, Pat.
Thank
be
you,
well.
Cindy. You take care. Bye-bye.
Yep, bye now.
Okay. I'm going to talk about a couple other. I'm going to now fill in everything that I heard yesterday from Ron DeSantis. He covered this thing beautifully. It was on the web, a special channel that you can go to. And if you want information, I'm going to throw out my website because I didn't bring that website with me. It's callsacco@aol.com. CALLSACCO@aol.com. If you send me an email, I'll send you the link back so you can watch the program that he presented. It's rather lengthy, but it's thoroughly covered. And I'm going to cover a good portion of it right now. I didn't know this, but there's a mobile lab the state has, and they can conduct 3,500 tests per week through a deal with CEPHEID, CEPID. They can do 3,500 cartridges per week in support rapid testing, a 45-minute result. And this is a mobile lab. This testing will start early next week, and we expect to have cartridges on Tuesday. The state is going to use it to test long-term care facilities, and we'll be able to get results on the same day. As Cindy said, they do their own testing. I'm sure others do, but here's an opportunity for more. That as testing continues, it has multiple applications: homeless, homebound, underserved populations, etc. And they're also setting up. They have recruited hundreds of professors and students from universities to assist with the COVID-19 response, including contact tracing. I hope if you don't know what contact tracing is, let's say I come down with the virus. Okay, I will make a list of all the people that I've been in contact with in, I don't know, last 30 days or whatever. And they will follow up and check all those people to see if they were contaminated by me. If they find that to be true, then they do the testing, et cetera, appropriate responses if necessary, and then do the contact tracing for the next group. In other words, this is a way of going out to the public and finding out who may have the virus but no symptoms, et cetera, or who may be a carrier. The schools that are contributing students are most of the Florida schools: FSU, USF, UF, UCF, Columbia, Nova Southeastern University, George Washington University, University of Kentucky, and Brown School at Washington, and University of St. Louis. That I did not know. What a fabulous idea that is, to get the students involved, because they're looking for something to do right now, and some of them are on virtual classes and some are not. Okay, let's talk about phase one. Ron announced that we will start phase one on Monday, this coming Monday, May the 4th. Now, phase one received input and advice from prominent physicians, healthcare system executives, small business owners, elected officials, unemployed Floridians, and law enforcement. They convened the Reopen for Florida Task Force, which produced a report with recommendations. The governor went to Washington the other day and reviewed all this plan with the president, announced the plan with the president. The president doesn't approve plans, but he is ultimately involved in it. And the governors are going to Washington to cover things. In fact, somebody today was going to be in the White House. Now, Florida, phase one. Schools will remain distance learning. In other words, we won't have schools back this season. Visits to senior living facilities are prohibitive. Elective surgeries can resume. That's a new one there. Restaurants may offer outdoor seating with 6-foot space between tables and indoor seating at 25% capacity. Now, if you have a favorite restaurant you want to go to next week, I suggest you give them a call as soon as possible and make a reservation and be one of those 25%ers. Retail can operate at 25% of indoor capacity. Now, right now, I know that I was at Sam's last week, and there was a line outside of Sam's with 6-foot distance between people. They had the set number of people in there, and they were not letting anyone else till someone came out. And that line moved fairly quickly. I was surprised. And that's probably what they'll do for retail operations. I'll use an example. I don't know if that's true, but let's say Dillard's is going to open up and they have X numbers of people they can let in. There will probably be somebody at the doors monitoring whoever leaves, they can be replaced. That's new. Now, I don't know if the mall is going to open. That's another thing we need to find out. There's no change for bars, gyms, and personal services such as hairdressers. But I have to call today and cancel my Saturday hair appointment for next week. Um, okay. Vulnerable, vulnerable individuals should avoid close contact with people outside the home, as has been before. All individuals, when in public, should maximize physical distance from others, and we have set a 6-foot space. Avoid socializing in groups of more than 10 people in circumstances that do not really allow for physical distancing. If you have to have a little crowd, keep it to 10. Face masks are recommended for all those in face-to-face interactions where you can't social distance. So we've added to several things, but he emphasized we're going to go very slowly in Florida. We're going to make sure this works. We're going to make sure that there's no increases or spiking in cases of the virus. And if that's the case over a period of time, which he didn't stipulate, we will go to the next phase. A very careful planning. The state maintains the health benchmarks of safe, smart, step-by-step plan. Maintaining hospital bed capacity. I'm going to talk a little bit about that later. And monitoring the COVID-19 test positively rate. This does not need to take months. It will be based on our health metrics and guided by medical authorities. He spent quite a bit of time yesterday going over comparisons between Florida and the other states that were highest on the list. Florida had ranked number 9, I believe, the 9th most vulnerable states, or the 9 states that had the highest ratios, and compared those ratios to each one of the other states. And it was amazing. You have to see these charts. They're unbelievable. And again, it's all based on data. It's all based on data. It's not speculating, well, maybe for the good of the public, we should do this. It's what the data shows. We can't have a high incidence of virus-infected people. We can't have high incidences of ventilators and packed hospitals and then open up, restrictions. These new restrictions, by the way, or the new phases, are not the entire state of Florida. Dade, Broward, and Palm Beach counties are exempt from this new phase 1. They will continue to do what they were doing today until their numbers come down, and then the governor will release each county as they conform to the statistics. That's been a bone of contention and a lot of discussion on the airways about, well, what do you do with a place like New York? Okay. You have New York City, huge population. You have Watertown, which is not very big at all. You have a small county somewhere in the state of New York. You can't do the regulations throughout the whole state because of the varying conditions. And what you have to do is release those counties, let's say, that are not having lots of deaths, lots of COVID involved patients, special needs. You have to vary it through the state. And so the governor has held up Miami and Broward County and Palm Beach County, where a significant number of the population of Florida is. And rightly so. There are walk-up testing sites that exist right now in those counties. And again, he made a list of those. There are supported sites like Miami Hard Rock, TIAA Bank Stadium, Orange County Convention Center, et cetera, Marlin Stadium, Raymond James Stadium, South County Civic Center in Delray Beach. These are testing sites, and they're going to be opening another 6 or 8 of them in those counties. Walk-up testing sites. Currently, there are them in Broward and Maine, in Dade and Palm Beach County, Duval County, Hillsborough County, Leon County. Then they're adding some more of those as well. So what we're doing is we're getting into the data business. Now, in fatalities in the state of Florida, comparing with the other states that are high on the list. I'll give you an example. Let me do just one. I'll go through this and you'll see where the trend goes. New York, this is fatalities per 100,000. New York was 117. New Jersey was 72. Connecticut was 58. Massachusetts was 45. Louisiana, 38. Michigan, 35. Illinois, 16.8. Pennsylvania, 14. Orange County, 2.3. Duval County, 2.0. Hillsborough County, 1.6. And as you can see, the trends that drop down with the fatalities. And the beautiful statistic from the state of Florida. The same thing with hospitalizations. Now, let me compare the one that's above us, Pennsylvania. This is per 100,000 patients. 27 or 21.7, Duval County 6.4, Orange County 3.8, Hillsborough County 2.6. COVID hospitalizations, 100,000 per. Again, with the states compared to the least next to us is Pennsylvania 21.7, Florida 9.8. Percentage of class beds available on selected dates for Florida. On March the 2nd, there were 12.6% of beds available. On April 28th, there were 41.3% of beds available. Almost half of the beds in the state of Florida do not have patients, do not have any kind of patient. In fact, is it Comfort? The hospital ship Comfort is leaving New York Harbor. There's no need for it anymore. They're going to be going somewhere else where there might be a need. And I understand we've been already sharing some ventilators with other countries because right now we have an oversupply of ventilators. Influenza-like illness visits, and this is for the state of Florida. On March 15th, there were 15,474, and on 4/19, it was 2,072. So we've come down from 15,000 to 2,000. And again, it shows the progression through the drop. We talked about being over that hump, being over that zone. Here is the projections. At one point, we were projected to have 465,000 hospitalizations. If we were doing 3 months of social distancing, it would have been 185,000. Florida hospital capacity, and it shows that actual Florida hospitalizations are down from the Florida capacity. Available ventilators in Florida. Okay. Right now, available ventilators are 6,347. COVID positive on a ventilator, 378. So we got over 6,000 ventilators that are not being used at this point. There was news on the news, I won't say what station, on April the 3rd, it said as political and health leaders look to the face of rapidly approaching peaks in COVID-19 cases, the need for ventilators will hit crisis levels. There will be likely come a point where there will be no more ventilators for shuffling around. Excuse me. And what happens next? Well, we realize that we are not in the crisis of ventilators that we thought we would be. And again, why not err on the side of caution? And we have done a great job in this state. Here's another projection on March 24th. In Florida, the model predicted 465,000 people will be hospitalized because of the virus. The illness caused by complications of the virus by April 24th but there will only be 36,000 hospital beds available by that date. And as we found out, there are very few hospital patients, and almost half of the hospital beds are vacant. Compared to Italy right now, with hospitalizations per 100,000 are 32.6, and with us, it's 9.8. And we were at one point we were told that we were not only going to be like Italy, but worse than Italy, like an Uber Italy. That did not come to pass. I'm just flipping through some of these things here. He talked about facts versus fear, and other things that I deal with. My statement is always that knowledge takes the fear away. I'm afraid. I have a diagnosis of something. I don't know anything about it. Nobody's told me about it. I'm scared to death. I'm going to die. Well, once I begin to get information about this process that I have or the problem that I have, it takes a lot of the fear away. The more you know, the more you can objectively look at a problem. Okay? Florida's plan against this virus was to protect the vulnerable, increase testing, promote social distancing, support hospitals and protect healthcare workers, and prevent introduction from outside of the state. And I think they did an excellent job in monitoring those people coming from other places earlier. Driving to Florida, they were monitoring I-95, they were monitoring 75, they were looking at 10. Look and checking people, see if they had fevers, whether they were ill or not. If they were, they were recommended for a 2-week in the home, don't go outside situation, and they were monitored for that. It wasn't a law. They didn't get arrested. They didn't get put into a detention facility. But we tried to control those people coming into Florida, and there was a great influx, by the way, of people from New York coming down. Many of them who had homes here, they were getting scared right in the beginning, and they decided to come to Florida. And, that it was a problem. And, in fact, the larger the population centers, the more likely there are to be victims from the disease. So yeah. I'm going to take a break, take a breath, and we'll be right back. Okay, we're back here on the forum, and we're talking about the information that was presented to us yesterday by our governor to move into phase one of our recovery process. And it was exciting to me to finally hear about phase one for Florida. I believe there's something between 20 and 30 states are moving into a lessening of some of the restrictions at this point. Probably close to half of the states, I believe. And it's going to take time. It's not going to be what Governor Cuomo in one of his news conferences said. We're not going to go back to normal, but we're going to have a new normal. And it's probably something we should have done a long time ago. I think handshaking is out. I don't think you're going to see too many more people, and I will not handshake anymore, just as a precaution. It's one easy way to transmit the virus, or to be close enough to somebody to handshake until it's over, and probably handshaking will not be as prevalent as it is today. Let me go back to some of this data. I pulled out some more. We're looking at fatalities per 100,000 cases. And I'm going to go through the different states again. Per 100,000, 117 New York, New Jersey 72, Connecticut 58, Massachusetts 45, Louisiana 38, Michigan 35, Illinois 16, Pennsylvania 14, and for Orange County 2.3, Duval County 2.0, and Hillsborough County 1.6. From 117 to 1.6. These are the fatalities. Hospitalizations. Currently, New York 25 per 100,000 patients. New York 25.8, New Jersey 20.4, Massachusetts 14.6, Illinois 10.3, Michigan 9.8, and Florida 2.8. And as you can see, we've done phenomenally with our lack of patience, and a lot of our attempts at social distances, staying at home, masking. All these things have really contributed to keeping our data really low. And again, we talked about hospital bed availability. There are a total of 68,735 licensed beds in the state of Florida. Total available beds, 22,000. Available capacity, 37%. So 37% of the beds are not being used, not being utilized. Cough-associated admissions, coughing was one of the signs, showed from January 1st, and this is in percentage point, 0.7%, and that reigned all the way consistently for a month to 226. It was the same. Then it started rising, and the peak of that was on March 25th and April the 4th. We were up to 1.5%. Right now, we're down to 0.8%. So we cut that in half from our peak. And we talked about, I didn't mention influenza-like illnesses visits. In March 15th, that was 15,474, and it started a steady decline to March 22nd, 8,900. March 29th, 5,778. 4/5 is 3,797. 4/12, 2,769. And 4/19, 2,072. And as you can see, that decline again. All these things showed that movement. And again, the governor was very careful to continue to make sure it wasn't just one of these points of data. When you might see something on TV, it talks about the mortality rates or one specific thing. He was looking at all these things. He had all these experts monitoring everything to make sure that we were heading in all of these facets in a decline. And that's why he took this time to announce. And he said something about he had been maybe ready a week or two ago, but he wanted to make sure that the trend still continues. Now, will there be a spiking when our restrictions are lifted? Yes, there will be, because guess what happens? Excuse me. People are not going to recognize or observe the distancing. They're not going to observe the masking, and there's going to be more virus spread. And we've got to be really careful. We don't want to get to a point or speak to the point where we have to put these restrictions back on again. And believe you me, they will do that if that's the case, because it's clear that at that point it's not ready to be released from all these things. I think distancing ought to be pretty normal for us. We ought to just try not to get involved in huge, large groups. Now, unfortunately, some of the protests that were done in some of the state capitals, people were out there elbow to elbow, no mask, no nothing, protesting the regulations. Well, they should have been 6 foot with masks protesting. It would have been a little more significant, saying we're conforming, but we want it released, rather than we're rebelling against it and we want it released. We just have to have a little bit more patience. We have been great as a nation in backing off, in putting our lives into neutral, not doing this, not going to the grocery or to the clothing stores, not going to getting your hair done, not going to bars. These are things that are regular with people. And everybody has been very compliant, especially in the state of Florida, as we have just heard. Again, I want to stress to you, please drop me a note. I will send you this link. You need to look at all this data. It is fabulous. And he talks everybody right through the whole thing. You can go online and to get the live programs that they save, and you can play them again. Just like our program, if you go on tcremembers.com, that's tcremembers with an S.com. Down at the bottom left, you'll see a link, little blue link, and you click on that, and this show comes up, and it's show in its entirety. If you want to review it, that I've given it, fine. Want to listen to Cindy's short presentation, that's fine. But we're trying to get information out to the community. And one of the things I'm going to be doing as soon as I can get the data out, and there'll be quite a few sites to be able to get tested as we go along. And I know one of the large pharmaceutical chains, I'm not going to announce it now because I don't have enough data about it, will be testing in their stores. And what I'd like to do is put out a list. I'm sure there will be other lists, but wherever we can be tested in Martin and St. Lucie and Indian River counties, I'd like to be able to put that out so people can use that as a guide to go and get tested. And I think everybody should get tested whenever there's an opportunity. Let's find out whether we've had the virus and we didn't have symptoms. Did we build up antibodies, and are these antibodies going to protect us? I can't remember the name of the drug. It's Remeron or something. Was being tested in another country. They're very excited about it. They were doing rhesus monkey testing, and they gave this drug to these monkeys and exposed them to the virus. And none of the monkeys contracted the virus. I understand phase 2 will be conducted like that. I think it's being planned right now to test 3,000 humans. Let's see what this might be. But they're saying there is a possibility that a virus or an antidote, a vaccine will be available in the fall, which is fabulous. Excuse me. A little tickle this morning. But be careful out there. Be vigilant, be safe, and be patient. Be patient. I saw a cute cartoon many years ago, but 2 vultures were sitting on top of a broken old tree. And one of them said, I'm hungry. And the other one says, hey, have patience. The other says, hey, patience. Let's just go kill something. Well, vultures don't go kill anybody. They wait. So don't kill your chances of getting this virus. Don't kill your chances of spreading this virus to someone else. Just be patient. Be patient. My grandmother used to say that to me in Italian. Be patient, my son, be patient. Because I was ready to do things and, do this and do that. And sometimes a little bit of caution goes a long way with us. You've done well so far. I know you're saturated on your TV. If you have video collections, as a matter of fact, we're going to finish in 2 days. We found the whole series of the series 24 with Kiefer Sutherland, and I believe that was produced in 2004. And every night we've been watching 4 episodes of the show, and I think we have another 6 episodes to watch and finish it up. And it's been exciting. At least it was something we planned to do. Either have watched one of the hour things before dinner and then watch another one after dinner or something like that. I'm sure you have a collection of VCRs or CDs. Look at a program you've never looked at before. You might find, I know we have DirecTV, and we go on and watch the old Tom Selleck Magnum series that we haven't seen in years and years and years. And Dick Van Dyke, Murder, and then also Angela Lansbury with her Murder, She Wrote. All these old shows. It's a time to go and just reminisce a little bit and take the time to do something fun. Read. Do your reading. If you have a Kindle or if you have a series of books, pull a book out of a bookshelf that you haven't read in a long time. I did that a couple of weeks ago, a book that I thought about, and it's been years and years since I read that book. Well, I'm about 85% through it right now. It's giving us a chance to kind of get ourselves mentally in order, mentally prepared for the next thing that's coming. It's not a punishment for us. It's a reward that we're doing. We're giving ourselves a reward by staying home, by observing the masking, by observing social distances, and going out as little as possible. That's something we're giving a gift to ourselves and not getting sick. It's like eating healthy or exercising, or whatever. It's a gift you give yourself, and continue to give that gift. Now, like he said, it's not going to be months, but it's not going to be tomorrow that we're going to go to phase 2. It's when phase 1 proves itself and not lending any additional sicknesses and illnesses. Then we will go to phase 2, then phase 3, then phase 4. It's better than not having been there. I've been waiting for this announcement for several weeks. I was hoping it would come earlier. I was really happy to hear it yesterday. And now I'm going to be anticipating in the next couple of weeks at least, hopefully something else will happen. If it happens, fine. If not, we're just going to wait because we have to have patience. And, again, the stores have been accommodating about delivering things. Hey, you might not have had a pizza in a long time. We'll have a pizza delivered to your home. Don't go hog wild. Now, we're not being released to go back to the old normal. Remember, because there won't be any old normal. There's going to be a new normal. And the more we conform, the more we comply, the quicker this thing is going to happen. So if you're out there, notice he didn't say anything about the beaches. Because when people go to the beach, they tend not to be too compliant. Obviously, they're not going to wear a mask. Obviously, they're not going to keep a 10-foot distance or a 6-foot distance or whatever. And I know that he did release the beaches up in Jacksonville, and they're restricted in their times. I think we probably had a problem when it was spring break, and we had a lot of people, a lot of young kids from up north coming down to Florida. And I'm sure some of them brought the virus with them. And if you watch them at the beaches, they were just like old times, packed. And that was not good. But there was no way to hold them back. And as soon as they left, the beaches got closed because it was a terrible source of contamination for this virus. And whatever you subscribe to, whether it's God or Allah or Vishnu or whatever, or even if you don't and you pray to a plant, give thanks that we did not get hit the way we were told we were going to get hit. We did not end up with 100,000 to 200,000 deaths. We're in the 60,000s now. We've just surpassed the amount of deaths that occurred during flu season. It's a shame too, because during flu season, we didn't pay too much attention to how many people died. Well, we're sensitive to these things now. And if we had done more precautions during the flu season, we probably would not have had the data we have. If we wear masks through the spring, through the fall, when it's flu season, I wonder what the dynamic result that would be for us. How many deaths would be saved? How many people would be saved from death? So those kinds of things, it's not that big a deal. Carry it in your car, put one on. Make a mask out of t-shirt. My wife is making masks out of t-shirts. She's made a whole bunch of them. She still has the same t-shirt that she's cutting up, and just did a new design yesterday and showed it to me this morning. And it's another play from the this is her third generation, I believe. You can make your own mask. You can wear a scarf around your face. But do it. Just do it. Just continue to do it. Bite the bullet. Let's be healthy. Let's not hurt anyone else. Let's not give someone a problem, transmit a problem to them. Let's be safe. And, a lot of people I've seen, I get an email, and they say, let's be safe. Well, let's be safe, but let's be smart. Let's be smart. We'll have our time. This will pass. This will pass, and the worst is over for us, okay? The worst is over. Let's not make it worse again. I can't emphasize that enough. Just cool it. Anyway, we are rapidly completing our show today. We have a few minutes, yes? 4 minutes left. Okay, good. I have Dr. Joe Wisbecki back again next week. If you recall, he was here a few weeks ago, and he's going to talk about more orthopedic problems. He works with Florida, what's the name of the company? Florida, I want to say Spine. It's not Spine. It's Florida Orthopedics. And, he'll come and give us some more information. Might want to call in with some of your problems. He's very willing to discuss these things with you and give you information. Again, remember, knowledge takes the fear away. I have this pain. I don't know what this pain means. Well, let's find out what it means. Let's, relieve yourself of your anxiety and find out what is happening to you. Rather than thinking, oh my goodness, it's just old age. I love old age because a lot of people who achieve because it is an achievement when you live a long time, they suffer from what I call hardening of the categories. By that I mean, oh, I don't want to touch that computer. Oh, I don't want a smartphone. Oh, I don't want to do these new things. Well, the new things are challenges. And every new thing you do, everything you do is what I call an adventure. Whether it's a positive adventure or a negative adventure. Gee, you're sick, you go to the hospital. Well, it's an adventure to go to the hospital. Sure is. It's an adventure to take a trip. And when it's done, the virus situation is done, you may never have taken a cruise. Take a cruise. Take a short one, a 3-day cruise somewhere. Go to Nassau or go to Freeport and take a little 3-day cruise. Several of the companies offer. But do something you haven't done and you wish you'd done. Look at your bucket list. Take a next step out because we don't want to be confined. We want to do what we need to do. Well, that's all for today, and we will be back very shortly on the forum. And stay safe.